Dr. Pawan Labhasetwar is Chief Scientist and Head Water Technology and Management Division, National Environment Engineering Research Institute NEERI. He has done his PhD in Environment Engineering and have specialization in field of water quality.
I would like to first introduce my institute, National Environmental Engineering Research Institute. It was established in 1958 and it was then titled as Central Public Health and Engineering Research Institute, CSIR Nagpur. So we started working since our inception on water-related issues. Our work initially was focused on water quality analysis, and we now also carry out work related to water quality. We added this component of surveillance since our inception, and then surveillance also is an important component of our work here in NEERI. After we realized that water which we are drinking also have contaminants, we got into technology development and evaluation. And we have came out with a technology known as the Nalgonda technique to remove fluoride from drinking water. And it's probably the first of its kind defluorination technology all over the world. And this particular technology, that is Nalgonda technique, is still used in some countries of Africa. Later on, after the advent of 2004, guideline for drinking water quality by WHO, we started working on risk management and risk assessment approach, which is now part of water management. We also conduct training here in NEERI, and we have been designated as key resource center by Ministry of Drinking Water and Sanitation, Government of India. We have conducted many training programs and probably trained around almost 1,000 chemists and microbiologists of different states. We also work on policy framework, and we came out with this uniform drinking water quality monitoring protocol in 2013, which has been followed by many states in establishing water testing laboratories. So this is all about NEERI. Now I'll come to the topic of water safety plan. So water safety plan is defined as means of consistently ensuring the safety of a drinking water supply using a comprehensive risk assessment and risk management approach that encompasses all steps in water supply from catchment to consumer. And this definition has been given to us by WHO in 2006. There are three major components of water safety plan in this definition. First is comprehensive risk assessment and risk management approach. And we try to assess and later manage these risks. And another phrase which is of importance is from catchment to consumer. So right from catchment to consumer, we try to identify these hazards and manage these hazards so that the consumer gets safe water supply. You might be aware of various water system elements, which starts from watershed, that is catchment, and then we have this extraction or source where the water can be drawn for supply. As water contains some contaminants, it's really essential to remove these contaminants, and then we have provision of these conventional water treatment plant. If we are treating surface water, and after this treatment scheme, we feed this water, treated water, to storage tanks, normally consist of master balancing reservoir, elevated service reservoir, or ground-based service reservoir. And through a network of water distribution system, we supply water to households. So this is an entire water system which we normally have in many cities and towns in India. So what is actually water safety plan? It has been introduced in 2004, and there are many incidences where this water safety plan has been successfully implemented. So starts with identification of water resources or sources, then it leads to treatment, then to distribution system, and at the end to consumer. So water safety plan is a documented plan that first of all identify hazards, assesses risks from catchment to consumer. This also later prioritize the risks and focus on highest risks. And this also talks about mitigating these risks through various control measures. It also means that we focus less on output monitoring, which we normally now do in India, but on more input monitoring to know whether system is working or not. So this mature is very important from less of output monitoring to more of input monitoring. So this is a crux of water safety plan. Okay, you might be slightly confused. So let us contextualize it. How did we actually use it in the context of healthcare facilities? So these are some steps which were used in preparation of water safety plan for healthcare facilities. And it starts with preparation of water safety plan team. And this water safety plan team should include officials from this utility, and in this case from healthcare facilities. The people who are managing water in that particular utility are complex. The next important step in water safety plan is system mapping. We have to map the entire water supply system, and in current scenario, in many villages, even in many towns also, we don't have this water supply system available to us. So similarly, when we carried out this study in healthcare facilities, no one was knowing what sort of water supply system we have. So with the help of these engineers and doctors, we started developing a map of water supply system in these healthcare facilities. This is another step of risk assessment. I will elaborate this risk assessment step in which we try to identify various hazards and try to rank them so that we can plan appropriate control measures. So these are the control measures based on the identified risk hazards we normally implement so that we can ensure safe water at consumer end. So it also requires to monitor effectiveness of these control measures. So we are like monitoring measures also in place as part of water safety plan. Once we implement this water safety plan, we are more or less sure that the water we are getting will be safe. With the quality of water which consumer gets will be safe. So we have to keep reviewing and revising this water safety plan because this is a live document. And then again, we come back to system mapping. So we of course carry out water quality monitoring and sanitary surveillance as part of water safety plan preparation. And we also consider revising improvement plan. The need for WSP at healthcare facilities. So large and complex healthcare water network systems are prone to contamination. There are many reasons for this possible contamination, which may include faulty infrastructure. They are very old pipelines. They are very old elevated service reservoir which had been put over there. There are overhead tanks which might be there without any repair for years together. There's lack of maintenance because healthcare facilities meant to provide relief to the patients, and its main job is to look after the patient which come to the medical or healthcare facilities. So this actually water supply becomes secondary. There's irregular monitoring and surveillance in case of healthcare facilities. That's what we have observed. And there's improper sanitation and hygiene, and it ultimately ends up affecting water supply in healthcare facilities. Most important issue which should be considered to implement water safety plan in healthcare facilities is acquiring nosocomial infections or hospital acquired infections due to poor water quality. And that is there have been many such cases reported in literature that the patient gets admitted for treatment of a particular disease, But once this patient is discharged from hospital or healthcare facility, he comes out with another infection, which might probably be because of poor water sanitation and hygiene in these healthcare facilities. So there was a study done in 2015 which rates this hospital-acquired infection very high in India than those reported by CDC in US. Of course, if you compare healthcare facilities in India and US, we have fairly poor healthcare facilities when it has been reported that nosocomial infection are high in US. Definitely, we will be having even higher nosocomial infection in India. So I don't think so there is any data available in India till date which uh, which includes details on various nosocomial infection. But in US, there were 43 outbreaks of waterborne nosocomial infection and over 2 million cases have been reported. So the studies available in Europe, 37,000 deaths directly attributed to nosocomial infections annually in healthcare facilities. And we believe, of course, in low resource countries like ours, preventable nosocomial infection related deaths in ICU may be 1/4 or more. So this is really huge statistics which clearly indicate that not only we implement water safety plan in these healthcare facilities, but at the same time we have to also study that how many are cases of nosocomial infection in India. So who is at risk in healthcare facilities? Yeah, of course, if you see the visitors who visit hospitals to look after patients, they're at low risk. Cleaning staff is at high risk. But more than that, doctors and nurses, because they spend a lot of time in these healthcare facilities, and the maximum risk is posed to patients and relatives accompanying during patient stay because they drink water over there, and secondly, they use these sanitation facilities in healthcare facilities. So they are at maximum risk in any healthcare facilities. So objectives of the study, which I'm talking about, are we have to assess water supply system in these healthcare facilities. We have to also identify most vulnerable groups of wards which are at maximum risk. We have to develop and document water safety plan for healthcare facilities. And we have to also facilitate prioritizing construction rehabilitation of various assets related to water supply in these healthcare facilities. And the last objective, which also is very important objective, so that we can replicate findings of this particular study in other healthcare facilities to have simple guidelines for WSP preparation and in implementation in healthcare facilities. So with these objectives, we started working on water safety plan preparation for healthcare facilities. We have gone around and we have chosen, say, different healthcare facilities where we can prepare water safety plan and even implement this water safety plan. So we have selected 4 different types of healthcare facilities for preparation and implementation of water safety plan. And there were 2 healthcare facilities from urban sector. They were mainly Government Medical College and Hospital Nagpur. And we have chosen private hospital, Medicina Multi-Specialty Hospital. We did this study around 2016-17, and Medicina Hospital was fairly new at that time. So they had, say, all new facilities in this this particular healthcare facility. And then we also chosen 2 healthcare facilities from rural area, and one was primary health center at Patan Savangi, which is almost 40 kilometers from Nagpur, and we also chosen government rural hospital at Saoner, which is almost 35-40 kilometers from Nagpur. So I'll explain how did we actually do water safety plan for these healthcare facilities, and the cost and major water safety plan preparation we undertook was for Government Medical College and Hospital. And this is the photograph of Government Medical College Hospital. And this is Asia's biggest healthcare facility with almost 15,000 outdoor patients and 1,400 beds. This was established way back in 1950s, I think. It has main hospital building, 44 wards, OPDs, 6 operation theatre, and it also has a renal unit in it. Attached to this particular government medical college is a tuberculosis ward, and which also hosts skin ward and infectious ward along with TB ward. And the super specialty hospital, which came later to GMCH, is also there. And this super specialty hospital is for nephrology, gastroenterology, neurosurgery, and surgery and cardiology. So it's a very big hospital. I think almost 70-year-old. So you might imagine that the infrastructure available there is fairly old. They have expanded also over the years, and that really complicated entire water supply scheme in this particular building. So we did detailed system mapping as part of water safety plan, and you might have seen also this is the second important step in preparation of water safety plan. So we had like this Rambagh sum from where the water is pumped, and this Vanjari Nagar elevated service reservoir. So this these two are the sources from where the water is supplied to Government Medical College, and the water supply to these two sources are from Nagpur Municipal Corporation. So there is a big sump in medical college premises, which also store water. And there is an elevated service reservoir in Government Medical College premises. And water from this elevated service reservoir are supplied to 55 overhead tanks in this premises, and then these are the wards in this particular building, and there are many overhead tanks, 55 when we did this study, and one particular tank is connected to 2-3 wards, and it also happens that a particular ward receives water from more number of overhead tanks. It's not that one overhead tank is dedicated to one ward. It's not like that. So this explains internal distribution of water within a given ward, and we have given an example of orthopedic ward number 16 here. So it has like sister's cabin, it has kitchen, it has patient's room, gents toilets, ladies toilet, washing area is also available, and that as well. So we have found out that this water also comes directly from this particular ESIR here for drinking purposes. And in washing area, water is supplied from overhead tank number 48. And similarly, gents toilets and ladies toilet in this orthopedic ward receive water from overhead tank number 49. So what happened over the years, the number of wards have increased, and there is no option but to connect many overhead tanks to different wards. So this is the system, water supply system, which had grown over the years. So we did extensive water quality monitoring, and you can see that when we monitored this thermotolerant coliforms, which is an indication of fecal contamination in water. So we found out that some had fairly good water quality. This outlet of some also had fairly good quality because they maintain a particular chlorine dose. So we can't expect thermotolerant coliforms in these ESR in these sums. Similarly, ESR also didn't have any thermotolerant coliforms. It indicates that water is fairly good in these three sources. But see the scenario inside the medical college. So you have seen direct supply tap, and then we found out 43 CFE per 100 ml of thermotolerant coliforms. Similarly, in overhead tanks also there were coliforms, and water it had tolerant coliforms as high as 300 CFU per 100 ml. Similarly, POE tap and water storage vessels also had thermotolerant coliforms. You might be aware that in India, the standard is that we should not have any thermotolerant coliform in drinking water. So this clearly indicates that the water is fairly safe up to CSIR, but once it's distributed to these sources, then water gets contaminated. So there's something wrong with the distribution here from ESIR to point of view water tap or in hot tap or overhead tank or direct supply tank. We also done water quality monitoring in different wards. So you can see in burn cancer ward, the contamination was not there. Similarly, in isolation ward and kidney unit also there was not much contamination. However, we have found out that some of the wards like Ophthal ward, really recovery ward has very high contamination, up to 300 CFU per 100. So it actually depends on types of maintenance in these two wards also. So in wards which has fairly good maintenance, probably doesn't have, say, thermotolerant coliforms in water, whereas in some wards where the maintenance is not good, it has, say, high number of coliforms. So we try to identify what are the possible causes of the water quality degradation, what are the possible hazards which contaminate water. So we have surveyed area right from sump to wards. So when we talk about this GMC, Government Medical College sump in which the water is stored because it's supplied to different wards, we have found out broken pipes which were leaking. We also find out presence of stray animals around this. There was structure damage due to plant growth. You can see in the picture the plant growth, which was actually damaging these sumps. And the wall chambers was waterlogged and they were very poorly maintained. What happens if there is any leak in this particular wall? The water is sucked in, and that probably contaminates entire water, which is provided to different wards. Similarly, in GMC ASR also, we have found out broken pipes and leakages, and you can very well see in the picture the leaking pipes, and you can see water accumulated over here, and this is possible if the pipe is leaking. Similarly, we also see in corroded pipeline, and this pipeline also clearly indicates that the water, these water pipelines are corroded, and which ultimately can lead to leakages. There was inadequate or poor maintenance of these water supply facilities, and this has actually resulted in contamination data I have already shown to you. We also studied distribution network, and you can see these pipes are crisscrossing each other. You can very well say here, and there are some pipes which carry wastewater. So that also adds to the problem. There's water logging also, that because water gets spilled over. So you can see there's no cover on this overhead tank, and there's no sensor available which can stop the pumping of water. In absence of that, the water spills over and then gets accumulated over the roof. There's structure damage due to vegetation growth. There are broken legs. And we also found out biofilm formation inside the tank. So there are many hazards which probably contaminate water. We have gone to the GMC taps because we started with the, say, catchment or source of water, and we run through many stages of water supply, and we came to this GMC taps and storage, and we found out that the flexible hose pipes, you can see that this type of arrangements have been made. These are very temporary arrangements to provide water to the patients. The cleaning mops were also found to be kept very close to drinking water taps. So you can very easily see that the bathrooms which are cleaned using these mops are kept very close to taps. The lack of maintenance you can easily see when you open these point of view treatment system, you find out that they were hardly clean. A biofilm on extraction containers, and these PU treatment units were improperly maintained. So there are many hazards which we identified, and they are very dangerous in nature because they can contaminate water. We also studied sanitary conditions and hygiene, not only in close to water sources, but even in bars also. So there was improper cleaning of floor. You can see these dirty floors, stray dogs inside the bars, irregular cleaning of toilets. You can see the toilet is not properly maintained. So these actually harbor microorganisms. This also say provides escape of microorganisms from this particular source to water. Yeah, we also visited biomedical waste handling facilities, and then we found out there's no proper check, animal access to this waste site, and there's irregular cleaning of toilets in government medical colleges. This also contributes to water contamination. So we prepared this table of hazard identification. As I told you, we started with source, went through some elevated surface reservoir, overhead tanks which receive and then again distribute water to different wards. We studied even distribution network. We had gone and collected samples, identified sanitary condition around water taps, storage vessels which are used by patients to fill up their water bottles. That also we have gone through, and then point of view water treatment system. So total number of hazards you can see each source were very high, and they have been divided into capital related and IEC related. So most of them are related to capital, but some of them like overhead tanks and distribution network can easily be overcome by using good IEC. So this is how risk assessment is prepared. This semi-quantitative approach is adopted. You can see these types of hazards like turbid water during events, biofilm formation at the inlet due to low and intermittent contamination due to vandalism or sabotage, increase of contamination due to corrosion. So we have to list all these hazards which can possibly contaminate water. So this is of say medium significance. Sorry, these are the like which type of hazard it is. It's microbial, physical, or chemical. So turbid water can have microbial biological hazard. So this is of course valid hazard. What is the category of this particular hazard? Is it due to operation and design? And we found out and categorize these hazards depending on operation and design. How likely these hazards to occur? Of course, we have ranked them based on say discussion with engineers who are there in a government medical college, and then we have to rate these hazards based on the criteria given in WSP manuals. We rated them from 1 to 5. So like contaminants in supplied water from ULBs, and then we found that they should be rated as 5 because the likelihood is almost certain. Its consequences seems to be moderate because we have point of use treatment system in place. So we're given ranking of 3. So once we multiply this 5 into 3, it becomes 15, and we can then categorize these risks from low to very high. So up to 5 risk listing is rated as low, up to 10 is medium, 10 to 15 we rank it as high, and above 15 very high. So there was one particular hazard which is ranked as very high. So this helps us in prioritizing these hazards. And similarly, we have to also propose control measures. So we have proposed many control measures like secured area, control access to premises, and visual inspection of pipes. And then we have to again validate these control measures once they are implemented. And then we have to again rank. So this is how risk assessment matrix is prepared. So we have proposed improvement plan, and then we have adopted 4 different steps in preparing and implementing these improvement plan. And then the first step was to interact with stakeholders, and stakeholders were like dean, professors, students, patients, their relatives, cleaning staff. So we've interacted with many people. And then the immediate plan was we have to do a regular inspection. We have to, of course, do water quality monitoring and surveillance. We continued helping them in water quality and monitoring. And discontinuation of use of strainer, mask, and gloves. We have found out that they were using even gloves also for filtering water, which was not correct. And we proposed short-term measures also for them, like repair and replacement of point-of-use water treatment units. For repair of eroded pipelines, we also shown you rusted pipelines and covering of all over tanks, and we found out, and I have shown also some of the over tanks which are not covered. And long-term plan was the upgradation of water distribution network, because this distribution was laid way back in 1917. That they kept upgrading this system, but unfortunately nothing was available. No map was available to us. So, like, we interacted with stakeholders, we provided technical assistance, which is necessary to improve, say, improve water supply system or ensure water there in hospital. We provided even training and made these people aware of issues like water quality, and we have provided feedback and improvement plan to, say, dean of government medical college. Similarly, we have done this study for Mediterranean Hospital, which is multi-specialty hospital. I think it was 4 or 5 years old when we did this study. It's private hospital, but still hosts 500 OPDs. Main hospital building contains 4 operation theaters, cath lab, dialysis ward, gas bank, ICU. And we also did system mapping, as we did it in case of government medical college. So they receive Nagpur water supply from Nagpur Municipal Corporation. They have provided a sum, and there's over a tank available. And from there, the water is provided through gravity to various drinking water access points. And they're located in many wards in this particular hospital. And they also had like wastewater treatment plant over there, because it was recently established. So they had decided to go for it. And they have proper biomedical waste management in this particular Mediterranean hospital. So, as compared to GMC, we could identify very few hazards in this particular hospital, but we find out because of lack of space, they provided sink next to water, drinking water, which should not have been done. So this was and then the filters also were gone through, and you can easily find out that these filters are not properly cleaned. So I'll cover now this WSP for Public Healthcare Health Center, Patan Savenki, and this is the site 3. It covers actually 47 villages and nearly 47,000, sorry, 4.7 lakh residents of these 47 villages. And they depend on this particular Patan Savenki Public Health Center. It has OPD. It is also IPDs, 12 bed facilities also available. So we also prepare the system, water supply system map for Patan Savenki Hospital. Also, they have borewell from where the water is provided to tap outside this PSC building. Underground storage is also provided, and there's a water cooler outside the PSC building over at tanks and quarters, because they get water from underground storage to over tanks. So we could map water supply system with the help from ward boys or some doctors who are there in the hospital for a long time. So we identified hazards. In this case also, there were leaky walls, there was no fencing at pump house, the point of view water filter they were using were not properly maintained, and drinking tap was outside the building, and this was the condition of drinking water tap. You can imagine some patients going over there and drinking water from this tap, and I'm pretty sure they will get this nosocomial infection. And the waste management in this hospital was also very, very poor. You can say waste littered around the campus. They had no check and no biomedical waste management scheme implemented in this particular hospital. This is the last site WSP for Regional Healthcare Training Center, Saoner. And it looks good, this particular building. It has 2 OTs, and it also had eye ward and gynae ward in it. And this was also center for health camps. We did system mapping in this case also. So they had dug well from the water is pumped to main building, and they had overhead tank on this main building, and then they supplied water to the two taps for drinking purposes. So we identify hazards which are more or less common in this particular hospital also: open dug well, corroded taps, non-functional PO units, these type of PO units. You can very well imagine that it has not been maintained for a long time. There's improper biomedical waste management here in this hospital. So you can see the campus littered with biomedical and other types of waste. And there's open sewer. You can see the sewer open, and this provides extremely hazardous condition because this also contains microorganisms from patients. So the key findings of the study are that we divided them into urban healthcare facilities and rural healthcare facilities. In case of urban healthcare facilities, the water distribution system is large and complex. For rural healthcare facilities, small and simpler. We are like WSP team members 8 to 10 in case of urban healthcare facilities, whereas we had only 4 to 5 in rural healthcare facilities. Water and Sanitation Authority in this case was trained and skilled, and they were appointed by them. And then this HAI committee, the Hospital Acquired Infection Committee, was also there in these two major hospitals, whereas it was absent in rural healthcare facilities. And microbial contamination range, which was worrisome for us, 3.5 log per 100 ml GMC. This is very, very high contamination. 0 to 1 log. Mediterranean, this is completely less. 3.2 to 4 log as against 0. We should have 0 microbial contamination. And the water in these 4 healthcare facilities are highly contaminated because of the hazards I already showed you. So this shows comparative hazard analysis at operation design and maintenance stages. So we had more problem with design in case of GMC because it was old building, whereas in case of PHC and then rural hospital, it was primarily due to operation. The building was fairly good. Operation and maintenance actually were causing major hazards in case of rural hospitals. So we discussed a lot with the GMC dean, and then he could help accept having this dog around. They have say introduced proper fencing to protect some, and then reinforcement of ESR was also done based on our recommendation. They also replaced corroded pipe, and so this is part of say improvement plan. And he was very kind. He had instructed all the engineers who were there to help in say implementing the measures we have recommended as part of water safety plan. And there were changes made inside wards also. They have renovated wards. So this renovation was going on. So which actually helped them to even consider our recommendation to improve water and sanitation facilities in these wards. And they had also installed new drinking water taps in the ward when we recommended them. So they have improved their sanitation and water facilities in these wards. And they also had reviewed the contact of point of view water treatment systems repair and maintenance. So in conclusion, what I want to convey is that WSP ensures safe water quality until consumed by users. So this is a very good approach. And this type of studies, unfortunately, have not been carried out in any of the hospitals or healthcare facilities. We are very, very complacent, and we believe that the water which is being drunk by patient is safe as against the findings which we had. Water safety plan study also helped us to identify all possible hazards and risks which contaminate water in these healthcare facilities. And we could identify critical points in water distribution networks, and then we realized that the water distribution system is leaking. We have to refurbish this distribution system. We have to also make exposure groups aware of aware of drinking unsafe water. Unfortunately, patients were not aware that say drinking water from these sources. Unfortunately, they didn't have any other access also unless they can pay for bottled water. So we have to make these exposure groups aware of these hazards and then provide them safe water. And the best part of water safety plan is to provide action plan for preventing, reducing, and controlling the identified hazards and risks, which otherwise will keep contaminating water in these healthcare facilities, and then the disease burden due to nosocomial infection will be very, very high. The way forward, which we feel, is nosocomial infection or hospital-induced infection in India is undermined, and we need to study to assess how much the disease burden due to poor wash in healthcare facilities. So this study is very much essential. We are working closely with WHO and Ministry of Health so that the wash facilities in hospitals can be improved substantially. Similarly, water safety plan needs to be made mandatory. I mean mandatory for all the healthcare facilities in following stages. We can develop guidelines for water safety plan preparation first, and later on we can implement these measures as we implemented in Government Medical College Nagpur. We have to train trainers so that subsequently they can also train other people to carry out water safety plan preparation and implementation of water safety plan. Similarly, we have to also pilot WSP in many healthcare facilities in each states. We tried to do it in Maharashtra. We thought that Ministry of Health will pick up and then this WSP can be replicated at other places also, but that couldn't happen. But we need to do that. We have to also carry out WSP implementation audit. This will help us to know that how much our recommendations have been followed. So this needs to be done. And we have to also at the last introduce this sanitation safety plan in healthcare facilities. This will help in taking care of both liquid and solid waste. You're seeing the condition of biomedical waste in these healthcare facilities, and they are like spread all over. The sewage is coming out. So we have to also carry out this sanitation safety plan, which will provide a total and holistic solution to have very, very comprehensive wash facilities in each healthcare facility. So at the end, I would like to acknowledge World Health Organization, Southeastern Asian Regional Office and India Office in New Delhi, Mrs. Pate and her colleagues, Dean and Doctors of Government Medical College, Nagpur, management of other healthcare facilities where we have carried out this water safety plan exercise, many doctors and healthcare workers who had helped during the course of the study, Public Works Department, which is responsible in implementing or providing water and sanitation facilities in these medical colleges or medical hospitals. Nagpur Municipal Corporation and Orange City Water Private Limited, we could get some of the data about water supply they have for these healthcare facilities. My colleagues Pranav, Rajeshri, Meenakshi, and others who had helped me to complete this prestigious project at the end, Director CSIR-NEERI. So thanks a lot.